It is a medical fact that any discomfort or pain in the knee in the absence of a serious injury is a signal that there is a malfunction somewhere in your body. That is, knee pain is not a cause, but a consequence of the problem. That said, it's a common belief that knees simply wear out with age, and it starts at about 354. However, this is not the case, and we'll tell you why. Yes, knees eventually start to hurt and cause a lot of discomfort, but the painful condition is affected not only by age, but even such non-obvious, at first glance, things as allergies, diabetes, the state of intestinal microflora, and even menopause. Most likely, you know or have heard the obvious factor: weakened muscular frame, ligamentous apparatus, overweight, incorrect redistribution of load on the joints due to flat feet, scoliosis, and other problems of the musculoskeletal system. In this video, we will prove that knees can live a long and very even mobility life, but it is important to address the cause of the pain rather than treating the knees directly. Together with an orthopedic doctor, we identified 13 hidden causes that cause problems in the strongest and largest joint in our body. The topic of our study is not related to serious types of knee injuries. We will not talk about fractures. We look specifically at the internal and external factors that cause the knee to become damaged from the inside out. The process is slow and imperceptible, so much so that most people rarely pay attention to the first symptoms. A person can be identified by their kneecap. Each person's patella is unique, just like their fingerprints. Let's take a look at what can hurt in the knee joint. The source of knee pain can be the heads of the bones. Overbite of the patella. Minuscule cartilage, on the other hand, is devoid of pain receptors. Ministerial cartilages are shock absorbers of movement. In a healthy joint, they allow the bones to keep their distance during movement and glide smoothly in the joint plane. If your knee hurts, there may be an area of bone somewhere that is not covered by cartilage, and the periosteum is reacting with pain. The knee can hurt, and with absolutely healthy intra-articular tissues, if the source of pain is damaged muscles, ligaments, and tendons. That is, about the articular apparatus that drives the joint. The first sign of knee joint damage is not pain at all. If the knee crunches when walking, it means that the cartilage is no longer healthy. Now let's get to our 13 causes and how to fix them. Post-traumatic pain. 50% of all musculoskeletal injuries are knee injuries. A fairly common situation is that you banged your knee. For a couple of days, maybe a week, it whines and seems to go away, and then the pain makes itself known again with greater or lesser frequency. This is what happens in the joint itself when a contusion occurs in such a case. The contusion causes hemorrhage, triggering the inflammation process. The cartilage or capsule of a joint is destroyed during an inflammatory reaction. The tissue is replaced by scar tissue. The unevenness of the joint surfaces causes pain on movement. What should be done when a bruise occurs? X-rays are necessary. If hemorrhage is found, the doctor will remove the accumulated blood and release pressure from the joint. As long as you feel pain, you can't move and take care of the joint. But it's worth loosening up more as you start to put more stress back on your knee. Doctors warn, until the joint has fully recovered, stressing it is tantamount to another injury. Joint blockage. If the pain comes on suddenly and literally makes you freeze in place, you probably have a joint mouse in your knee. This is the name given to scraps of joint tissue that have become embedded in the joint cavity due to trauma or deformity. What's going on in the joint? The joint cavity is a closed space with no way out, so large pieces of tissue move around in the joint as if a mouse were running around in it. But periodically the mouse gets stuck between the joint surfaces, so there is a blockage. It is impossible to predict when a block will occur. How do you get rid of the pain? Again, you need to take X-rays and see how big these scraps of joint tissue are. Only small fibrin particles are able to dissolve on their own. Arthritis and arthritis. Arthritis is a change in a joint from an inflammatory response. Most often, inflammation affects the synovial membrane, which is rich in blood vessels. When inflamed, this sheath becomes very swollen and begins to secrete inflammatory fluid. Osteoarthritis, on the other hand, is not an inflammatory lesion of a joint. In osteoarthritis, tissues gradually break down for two reasons. The knee experiences a load that it cannot bear, or from various diseases, the structure of the cartilage is disturbed and it becomes brittle. Here's how you can tell the difference between arthritis and osteoarthritis. The typical signs of arthritis: throbbing, shooting pain at rest and on movement, redness of the skin, swelling of the joint, hot skin around the joint, limitation of movement in the knees. And here are the signs of osteoarthritis. In osteoarthritis, the knees are crunchy rather than swollen because there is not enough fluid inside the joint. Starting pains are present. They appear at the very beginning of movement and go away after 10 to 15 minutes if you keep moving. Runner's knee. In this case, the pain is felt on the outside of the knee and occurs when you run, pedal a bike or exercise machine, dance, or go uphill. Runner's knee is indeed a professional injury for soccer players and runners, but in most cases this problem can be avoided if the sporting activity is done in a physiologically correct manner. Let's get to the bottom of this. What's going on with the knee? The cause of knee pain is the friction of the patella and the thigh bone, but it's not just the heavy load on the knee, it's also the weakness of the thigh muscles. Due to weak hip muscles, the knee does not bend enough when running, and the femur does not make full contact with the patella. As a result, the load on the kneecap is not evenly distributed, and the cartilage of the patella gradually erodes. What should you do to avoid runner's knee problems? If possible, train under the supervision of a professional trainer or take regular counseling sessions. Be sure to do a long warm-up of at least 15 minutes with a mandatory focus on your thigh muscles and joints. Choose shoes that cushion movement and match them to your sport. Increase the load gradually. At the slightest pain in your knees, pause your workout routine. An infant's patella is not bone, but elastic cartilage. Nature foresaw that the child would often fall on his knee while he was learning to walk, and spared the baby from a serious patella injury. Flat feet. First, you have foot pain. Then the knee, then the hip joint, and then the spine starts to hurt and curve. It is flat foot that is characterized by this cascade of overload. What's happening to your body? With flat feet, the ligaments of the foot are too weak from birth and cannot tighten the muscles so that the foot stands upright on a hard surface. But in order to somehow maintain the balance of the body, the hip turns slightly inward. As the articular surfaces change their usual position, movements in the knee joint do not occur correctly and all the tissues wear out quickly. What do you need to do? It is imperative to identify the degree of flat foot with an orthopedic doctor and be monitored regularly to detect dynamics, especially if you are involved in sports. Select special insoles or shoes. This will help to relieve all or part of the pain of movement. Find a specialist in therapeutic physical training who will make a special set of exercises specifically for your problem. Overweight. At first, the numbers on all scales increase, then there is discomfort in the knees, and soon certain body movements are accompanied by pain. That's what this is about. In the upright position, the femur presses on the meniscus with the full weight of your body. The mini, as we recall, is a cartilaginous shock absorber that allows the bones to keep their distance when moving. When healthy, it can hold 65 to 70 pounds. And if that's your weight class, that cartilage regenerates very quickly and naturally. With each extra pound, this cushioning tissue wears down faster than it has time to recover. This results in areas where the bones touch each other and the periosteum responds with pain. Look at the relationship between weight and the risk of getting a cartilage tissue problem. If you gain 5 pounds, your risk of injuring your knee increases by 36 cents. If you are 10 pounds overweight, your risk doubles.
What to do?
As banal as it may sound, but to get rid of knee pain and allow cartilage tissue to recover before irreversible changes occur, you need to lose extra pounds. Backer's cyst. You may experience discomfort behind the knee. Sometimes, along with the pain, there is numbness on the back of the lower leg, especially after a long walk or climbing stairs. The cyst gives painful sensations, if it increases so much that it can be felt, and while it is small, it does not manifest itself in any way. A Baker's cyst is a colorless, fluid-filled mass in the hamstring fossa. A cyst forms in two cases: when the synovial membrane becomes inflamed and when the knee is traumatized. What to do when you discover it? In rare cases, cystoid disappears on its own, but usually specialist help is required. The cyst can be managed quite well with physical therapy or drainage. Allergies. If you ate something exotic just a week ago, or started treatment with new medications, and now suddenly your knees are swollen and sore, you probably have allergic arthritis. Here's what's going on. An allergic reaction forms immune complexes in the body. The immune complexes themselves consist of antibodies and their associated allergens. Immune complexes are carried with the bloodstream and enter the sheath, including the synovial membrane of the joint. There are many immune cells in the joint sheath, constantly cleansing the navial fluid. If an immune cell encounters an immune complex, activation occurs and it releases substances that trigger the allergy right in the joint. What do you need to do? The good news is that allergic arthritis goes away without a trace, so you just need to know exactly what you're allergic to and not come into contact with the allergen again. Disturbance of intestinal microflora. In 90% of cases, it is a matter of poor nutrition. If you have not taken much care of your diet for a long time or have any intestinal pathologies, then most likely you have a disorder of intestinal microflora. In this state of imbalance, a regular jog in the morning can be the beginning of knee cartilage damage. Why is this happening? Healthy gut flora protects our knees. It regulates overall immunity, prevents harmful bacteria from entering the bloodstream, and most importantly, secretes substances that nourish ligaments, muscles, and cartilage. More than 80% of the cells that protect the immune system are found in the gut. Diabetes mellitus. Pain in the deer may be the first symptom of insulin deficiency. This hormone is not only necessary for glucose absorption, it is involved in stimulating cartilage and bone growth. Without it, cartilage regenerates much more slowly, especially against a background of high sugar levels. In advanced diabetes mellitus, deep sensitivity is reduced. You won't feel pain even if you make an awkward movement and sprain your knee ligaments. Your cartilage will silently deteriorate. If you have diabetes, pay attention not to knee pain, but to swelling and difficulty bending or extending. If the hormonal background is disturbed, it is necessary to consult an endocrinologist. Until your hormone levels normalize, no popular arthritis remedies will help you. Chlamydia. If you are experiencing knee pain after treatment for a urinary sex infection, there is a good chance that chlamydia is the cause. What's going on in the body? After treatment for urogenital infection, some people have particles of the pathogens, chlamydia, left in their bodies. By themselves, they cannot cause infection, but they represent a foreign protein to the body. Once in the joint cavity, chlamydia proteins trigger an inflammatory response.
What to do?
Don't rush to use the same medications you were treated with for chlamydia. As a rule, by the time arthritis develops, the pathogen itself is no longer in the body, but the immune system doesn't know about it yet and decides to hedge against infections. In 70% of cases, such arthritis passes without consequences, and only 30% of patients pass into a chronic form. To cope with the disease, a rheumatologist or immunologist can help you. Hormonal imbalance. If you have been able to rule out all of the above factors but still have knee pain, get your hormone levels checked. Thyroxine. When there is a deficiency of thyroid hormone, mucous edema occurs in the joint tissues. The knee swells and there is a feeling of stiffness. If there is too much of the hormone, however, the bony surfaces of the knee joint deteriorate rapidly. Self-otropic hormone is a growth hormone. Its excess changes the structure of cartilage, synovial membranes, tendons and bones of the knee joint. Instead of elastic fibers, they accumulate a lot of collagen. Too thick cartilage reduces the size of the joint gap, and fluid accumulates in the joint cavity. This results in stiffness during movement and pain. Cortisol. The stress hormone cortisol accelerates tissue destruction and inhibits the formation of new cells. Bones are quickly deprived of minerals and walking causes knee pain. Climax. After menopause, women's knees are left without hormonal support, and even walking in heels can injure the knee joint. Why is this happening? It's all about estrogen. The female sex hormone estrogen protects your knees from getting old in several ways. First of all, the hormone inhibits inflammation. Secondly, it provides elasticity to the ligaments and helps retain water inside the joint. Finally, estrogen prevents a woman from gaining extra pounds.
What to do?
If there are no serious blood pressure problems, the gynecologist will prescribe hormone replacement therapy. Her goal is to restore estrogen deficiency. Top 3 knee support products. In conclusion, let's talk about what you should consume to help your knees recover. That said, don't forget how important it is to address the root cause of the storm. The first product is Joint Protector, omega-3 acids. Omega-3 polyunsaturated fatty acid complex you can find, for example, in the flesh of salmon breed fish. These acids help us fight oxidative stress, which is one of the gas pedals of joint damage. Feel free to add sardines, mackerel, tuna, pink salmon, herring to your menu. Warning: omega-3 is not fish oil, which is derived from cod liver. Fish oil, in some cases, on the contrary, can increase inflammation in the joints. The second product is collagen. Cartilage collagen is a protein. To allow cells to gold the hole in your cartilage, you need to add protein, both animal and vegetable, to your menu. Collagen for knees will help to collect lean meat, fish, dairy products, legumes. In the tendons and cartilage of salmon, you will find chondroitin, an analog of cartilage. It stimulates the metabolism of cartilage tissue and slows its destruction. The third product is sulfur. People with joint pain have less sulfur in their bodies than healthy people. The whole point is that sulfur is consumed very quickly. If you need to build new collagen, speed up metabolism, and increase the body's endurance, sulfur comes to the rescue. You can replenish your stores of sulfur, which is useful for the body, with the help of eggs, chicken, cheese, buckwheat, milk, cabbage, sesame seeds, nuts, and soybeans. To keep your knees from crunching and pain, you should consume at least 2.5 liters of fluid per day. After all, the cartilage matrix is 70% water. Everything else is a mesh that holds the water. If, because of knee pain, you decide to take care of the joint and lead a sedentary lifestyle, you will only make things worse. The less you move, the less nourished your cartilage becomes. And it is nourished during movement, when water from the cartilage moves into the joint cavity and is infused with beneficial substances. When you stop exercising, the water along with the nutrients are channeled back into the cartilage. For your knees, movement is an opportunity for your knees to stay healthy.
This content is for informational and educational purposes only. Consult with a doctor or healthcare professional before following any recommendations provided in this video. Tell us about your experience in the comments and subscribe to our channel.